Hello guys, let's talk about a STEMI patient management in short. STEMI stands for ST elevated myocardial infarction. So there are two possibilities, that is STEMI patient shows at a PCI capable hospital or a STEMI patient shows at a non-PCI capable hospital. So we will study first about if the STEMI patient shows at a PCI capable hospital. So when the patient shows at a PCI capable hospital, send the patient to cath lab. Okay, cath lab, and the first medical contact to device time should be less than 90 minutes, which means first medical contact is the patient at the hospital and the device is primary percutaneous intervention. Okay, so this time should be less than 90 minutes. Now what to do if the patient shows at a non-PCI capable hospital? Then this non-PCI capable hospital becomes the first medical contact. Okay, so here there are two situations. Now if the first medical contact to device time, that is the PCI time, if it is possible to transfer the patient to a PCI hospital and the first medical contact to device time is less than 2 hours, that is less than 120 minutes, we will definitely transfer the patient for primary PCI because PCI is more effective in treating STEMI. Okay, but what if the anticipated first medical contact time to device time is more than 120 minutes? Then we will not transfer the patient to a PCI hospital. In the same non-PCI capable hospital, we will administer the patient with a fibrinolytic agent within 30 minutes. This is known as door to needle time. Door to needle time is less than 30 minutes. Door to needle time is about administering a fibrinolytic drug like streptokinase. It should be less than 30 minutes. Now it's not like that we have administered a fibrinolytic drug and the patient now once a fibrinolytic is administered, we have to check whether the fibrinolytic therapy was successful or not successful. If it was unsuccessful, that is there is failed reperfusion or there is reocclusion, then urgently we have to transfer the patient for PCI, and such PCI is known as rescue PCI. Now what if the patient's fibrinolytic therapy was successful? Even then, within 3 to 24 hours, we have to transfer the patient for PCI, and such a PCI is known as facilitated PCI. Okay, such PCI is known as facilitated PCI. Now once the patient is inside a cath lab for PCI, in any of these situations, either this or this or this, once the patient is inside a PCI lab, we do a diagnostic angiogram, and followed by that simultaneously we do a PCI. Okay, this is how we manage a patient with STEMI. Nowadays there is no role of CABG in the management of STEMI. Thank you.